When choosing a place to live, accessibility of affordable health care is a quality of life issue. In the event you can't afford quality health care, there are programs out there that can help you. One such program is the Polk County Indigent Health Care Plan. Joining us in studio to talk a little bit about the Polk County Indigent Health Care Division is the Division Director, Jan Howell. How you doing, Jan?
Hey, how are you?
I'm doing great. Now, let's talk a little bit for the folks at home that might not know. What exactly is the Polk County Indigent Health Care Plan?
Well, the Indigent Healthcare Division has several programs, and the Polk Health Care Plan is one of those. It functions very similarly to a managed care type of health plan and basically provides health care services to about 7,000 or so Polk County citizens who are card-carrying members of that managed care type of product. Then we have other programs and contractors that we fund as well with local indigent healthcare surtax dollars. So those go to people who are basically church organizations, free clinics, faith-based organizations, things of that nature.
Well, let's back this up a little bit and tell us exactly how this program started and how exactly it's funded.
This program is funded through a voter-approved sales surtax that the voters put on the referendum in 2004. And before that, there had been an old Polk General Hospital. But at this point, they turned it into a health plan with a network of providers that was considered to be a more efficient functioning of the funding that was available at the time. And at this point, there's annually about $30 million that's used to provide care in actual physicians' offices, whether that's a primary care physician or a specialty care physician. We've got about 100 primary care providers and 250 specialty providers in our network, as well as all 5 of the regular Polk County hospitals. Then we additionally fund some of these other free and faith-based organizations here in this community that provide volunteer services. So that functions to provide an array of services and care to different segments of the population under 200% of the federal poverty level.
And that number often fluctuates depending upon where the level is, right?
Yes, last year, 29,000 to 30,000 people overall, unduplicated individuals with Polk County citizens were served using this indigent healthcare surtax.
Let's talk a little bit about the program itself, the advantages of not only being handled here in this county, but the advantages of everything that it brings economically.
Right. Actually, healthcare is a really interesting area because it can actually act as an economic engine for providers and for physicians and hospitals, provider entities in the local area. So we, as the county, because we have that county governmental status, are able to leverage local match dollars to bring in state and federal funding. And I'm really excited because we've got some programs that we've been able to do that for the last 4 years, and I think we are right now at about $55 million additional money that we've been able to bring in over 4 years with local dollars, as well as about $25 million that has been cost avoided.
We're going to talk a little bit about a few of those programs in just a moment, but one thing that a lot of people may see the program, it's public health care. I had the privilege of spending a couple months between your intake staff, some of the clinics, some of the people that the program benefited. Tell the folks at home that this is quality health care.
Right. Because this is local taxpayer money, and we actually have a very, very, very low administrative overhead, it's frankly amazing that we are able to provide per member per month at a cost of about $250 to $275 per person in that Polk Health Care Plan product. We're able to provide them with not only the care, but the administrative cost of us handling the networks, the contracts, as well as overseeing those contractors and monitoring the quality of care with each of the physicians and provider entities. So we have done that over the last 4 years. We've refined our contracts. We've added additional quality of care standards so that they are across the board in the community. And we've been very pleased to see that improvement and to see just the measurement being there where it wasn't before.
Now, you'd mentioned the fact that there are grant dollars involved, and you've got a brand new program coming up that we need to let the folks at home know what's going on.
Yes, actually that indigent healthcare division functions very much like a safety net program for the community. So it funds a lot of the safety net providers. We hear a lot about the need for a safety net in this time of affordable health care and the focus on that. So what we basically in that division try to do as an arm of government is to use the funds to bring to leverage local money. And there's one opportunity today that we really wanted to outline for you. That is the Primary Care LIP Grant Program. So the Polk Healthcare Plan was able to take $1.7 million and provide that to the state government, who then got an additional up to $4 million total from the federal government, and was able to fund a hospital partnership with Lakeland Regional Medical Center, with the Polk Health Department, and with Peace River Center, with us at the Polk Healthcare Plan acting as the funder, the local funder, in order to leverage those funds and bring them in. We were really thrilled to be able to work with each of these partners, and this is one of the most exciting pieces of the safety net program that we provide, because you're talking about co-location of behavioral health services with physical health services at 3 or 4 different locations in the Lakeland area, which, as we know, is really an area that has a lot of homelessness and a very large population of the most vulnerable. So it's very important for us to be able to treat those people who are the most medically vulnerable because of their behavioral health needs, as well as dental and pharmacy. We were able to leverage that program to get Lakeland Regional the 340B pricing. So that's pennies on the dollar in terms of the cost of pharmacy pricing for those patients who end up going to the Lakeland Regional Family Health Center right across the street from the Lakeland Regional Medical Center's emergency room. And then the Polk Health Department, which is located on Lakeland Hills Boulevard, and they often see many types of adult primary care patients, but they do a lot of that dental work. Then right across the street on Lakeland Hills Boulevard as well from the hospital is Peace River Center's department that provides those behavioral health services, acting as a primary medical home. So that wraps the primary care around the behavioral health home for those patients who have behavioral health needs as their primary need.
And talk about the importance of when people think of medical costs and things along that lines, and medical plans. Talk about the importance of partnering with Peace River for mental awareness.
Absolutely. I think education is one of those things, and we're seeing with the Affordable Care Act and the accountable care organizations, all sorts of mergers. Many people are discussing integration of care. Certainly integration of care is not new to healthcare and to the healthcare community. It's just that we are starting to see those providers providing care at a tighter and tighter level. So when we are able to partner with people like Peace River Center, that gives us an opportunity to provide patients with more comprehensive care. And other people may use the term holistic care, so that you truly have a patient-centered model of care with a medical home that sees that not only is the primary and physical health important, but that the follow-through with the behavioral health side, as well as the specialty care, is very important in seeing that patient's quality of care improved. And that's what we are ultimately in this indigent healthcare division interested in seeing those tax dollars do, is improve the quality health outcomes of our community citizens.
Talk a little bit about there was, people that couldn't afford a plan like this, if, say, they ended up with something like diabetes, they would show up at an emergency room with a problem where it kind of increased costs along the way, where with programs like this, if you catch them in the early stages, you're working the prevention. So talk about the importance of how this program just completely, cures a problem of using an emergency room as a way of taking care of something like that.
Absolutely. That's always an important concern for every community, and certainly for every hospital system, is watching those emergency room visits and trying to determine how can they reduce their readmission rates. And so we're seeing many hospital systems that are opening up the primary care clinics in order to be able to treat the whole patient in the most appropriate setting, from both a quality of care as well as a cost of care equation. So basically, I think that there's a recognition that most of America is dealing with 5 chronic illnesses, and diabetes is one of those, as you've mentioned, as well as the cardiac conditions, COPD, asthma, things of that nature. So you've got your respiratory, your cardiac, as well as your diabetic. And I think I've actually talked to one of our largest providers about the diabetic patients who struggle with behavioral health concerns. And when you get someone, a patient who is that complex, who has hemoglobin A1Cs that are well above 7 and well above 9, and you start seeing that there's behavioral health issues, those people are truly in need of special services and patient care coordinators to wrap around their care to help them navigate the system. And I think that we as a community, and certainly this program, is really more focused at this point on patient care coordination and patient navigation than anything else. We love to see the system come together, but the truth of the matter is there are still many links in that system and issues with integration and coordination of care. So we love to see that prevention occur. We simply know that it will not occur if we don't put those special services around the patients to allow them to get those preventive health measures taken so that they can prevent the chronic illness.
All right, so we're going to recap the LIP program. What exactly is it one more time? And I think we really need to touch on the fact that the investors in this program, which are the residents of Polk County that pay that half-cent sales tax, and what they're getting out of that.
Absolutely. So the investors of Polk County, the taxpayers who pay that 1/2 cent sales surtax, basically, in terms of the primary care LIP grant program, there was $1.7 million that brought in an additional $2.3 million for a total of $4 million that came into Polk County's system, and that is geared toward hospital services in the Lakeland area through Lakeland Regional Medical Center and the Lakeland Regional Family Health Center, as well as the Polk County Health Department and Peace River Center. So we are all working together through that low-income pool and that primary care low-income pool. This was actually one of the highest hospital services funded. The application was seen as very worthy of funding, so we were very thrilled to be able to be that competitive on the state level with other new hospitals. So at this point, what are the taxpayers getting? They're getting $2.3 million of additional health care that they would not otherwise be getting. And they're getting it in a more fully integrated setting where the quality of care should be better, because you can have not only a primary care issue, but a behavioral health issue that is screened immediately upon recognition of that issue existing.
Well, Jan, I want to thank you for coming in today and sharing all that information. My head's still spinning. Thanks for coming in today.
Thank you.
All right, and you at home, we want you to know that the Polk County Indigent Healthcare Division, being good stewards of the taxpayers' money, investing it back into the community that we work live, and play in. And you need more information on what the program does. They're partnering with Peace River Center, Lakeland Regional Family Health Center, and the Polk County Health Department, just to name a few. Now, if you need more information on them, you can go to the county website. That information is at www.polk-county.net.